First EKG chapter free at practicalems.com.
So what's our question? With palpitations, we're asking dysrhythmia. And in a 65-year-old female, they can kind of have some vaguer complaints and present with an MI. So we're still asking MI on this particular patient as well. So the rate looks kind of fast, so I like to use the box method here. This one falls right on a big box, so 300, 150, 100. Rate's right at about 100. Looks like pretty regular complexes too, maybe just slightly irregular there, but overall it looks pretty regular. I don't see obvious P waves before these QRS complexes. Maybe that's a P wave, but they don't really appear to be consistent PR intervals. And if you look at V1, this is a pretty typical pattern for a flutter. These are flutter waves. And the other thing is when a rate's right at 100, especially when it's consistently at 100, and you have these typical flutter waves, it looks like it's probably 3-to-1 A-Flutter. And so if you have some of the leads that look like flutter waves, and you have a rate that's consistent, like 100 with A-Flutter and its different variants, you can probably call this A-Flutter, especially with no consistent P waves and PR intervals to really measure. So interpretation, I would say 3-to-1 A-Flutter. Sinus tach is still in the running, but again, we have these typical flutter looking waves and a rate right at 100, so I think we're probably right on with an interpretation of A-Flutter. So our final interpretation, 3-to-1 A-Flutter.